Many couples assume that once a man fathers a child, his fertility is guaranteed for life. But what happens when a man who's already had children struggles to conceive again? This is called secondary male infertility, and it affects 30 to 50% of infertile couples. Today, we'll explore why previously fertile men can face fertility challenges later in life, what causes these changes, and most importantly, what can be done about it. Understanding secondary male infertility. What exactly is secondary male infertility? It occurs when a man who has previously fathered at least one child naturally cannot achieve conception after 12 months of regular, unprotected intercourse, either with the same partner or a new partner. Unlike primary infertility, where a man has never fathered a child, secondary infertility often catches couples completely off guard. They think, "He's already proven he can have children. Nothing has changed." But that's not quite true. Why does this feel so surprising? Because fertility isn't static, it's dynamic. Aging, lifestyle changes, infections, and chronic diseases can all reduce sperm quality over time, even in men who were previously fertile. The reproductive system that worked perfectly years ago may not function the same way today. How male fertility changes over time. Let's talk about the biological reality. Men produce sperm throughout their lives, but the quality of that sperm doesn't remain constant. Age-related changes are significant. While men don't experience menopause like women, sperm quality does decline with age. After 40 to 45 years, men face higher rates of DNA fragmentation in sperm, lower motility, and increased genetic mutations. These changes increase the risk of miscarriage and infertility. Hormonal shifts also play a role. Testosterone gradually declines with age in a process sometimes called andropause. Subtle changes in other hormones like FSH, LH, prolactin, or thyroid hormones can reduce sperm production. Add stress, chronic illness, or obesity to the mix, and hormonal balance deteriorates further. Testicular function may slowly lose efficiency. Even if a man's testes produced healthy sperm years ago, they may not maintain that same level of performance indefinitely. Finally, accumulated lifestyle effects matter. Years of weight gain, poor diet, smoking, alcohol use, or exposure to environmental toxins can cumulatively damage sperm quality. Even moderate long-term exposure can lead to infertility despite previous successful conception. Major causes of secondary male infertility. Secondary infertility usually results from new or progressive issues that weren't present during the first conception. Let's break down the main culprits. First, sperm quality changes. Even if sperm count appears normal, subtle defects develop over time. DNA fragmentation from oxidative stress, infections, or aging can break DNA strands in sperm, affecting fertilization and embryo development. Changes in motility and morphology reduce sperm's ability to reach and fertilize the egg. Epigenetic changes, chemical modifications to sperm DNA, can alter gene expression in embryos. Second, hormonal and endocrine disruptions. Low testosterone reduces sperm production and libido. Thyroid imbalances alter spermatogenesis. Elevated prolactin or cortisol from stress or medication disrupts fertility. Even subtle hormone shifts can drastically reduce conception chances. Third, structural or anatomical changes. Varicocele, an enlargement of veins in the scrotum, may develop or worsen over time, raising testicular temperature and damaging sperm. Blockages from infections, surgery, or scarring can cause obstructive azoospermia. Physical injuries, sports accidents, or infections like mumps or chitis can damage the testes. Fourth, infections and inflammation. Sexually transmitted infections like chlamydia or gonorrhea may cause long-term scarring. Chronic prostatitis or epididymitis impairs sperm transport or motility. Diagnosis and testing. If you're facing secondary infertility, comprehensive evaluation is essential. Start with a detailed medical and fertility history. When were previous children conceived? What lifestyle changes have occurred since then? Any infections, injuries, surgeries, medications, or chronic diseases? A physical examination checks testicular size, presence of varicocele, and signs of hormonal imbalance like gynecomastia or hair loss. Semen analysis is crucial, but multiple tests may be needed to detect subtle changes in volume, sperm count, motility, and morphology. Advanced testing includes sperm DNA fragmentation tests, oxidative stress assessment, and hormone profiling for testosterone, FSH, LH, prolactin, and thyroid hormones. Genetic evaluation may be necessary in some cases. Imaging studies like scrotal Doppler ultrasound can detect varicocele or testicular damage. Treatment options. Treatment depends on the underlying cause, but there are many effective options. Lifestyle interventions are foundational. Quit smoking and alcohol. Adopt a balanced, antioxidant-rich diet. Maintain a healthy weight. Exercise moderately. Reduce stress, and avoid heat exposure and toxins. Medical therapy includes hormone replacement for low testosterone, medications for thyroid or metabolic issues, and antibiotics for infections. Surgical interventions like varicocelectomy for varicocele or surgery to remove blockages can restore fertility. Supplements and antioxidants such as coenzyme Q10, L-carnitine, vitamins C and E, zinc, and selenium support sperm motility and DNA integrity. When natural conception remains difficult, assisted reproductive techniques offer hope. IUI, or intrauterine insemination, works for mild sperm dysfunction. IVF, or in vitro fertilization, is useful when sperm motility or quality is reduced. ICSI, or intracytoplasmic sperm injection, involves injecting a single sperm into an egg and is particularly helpful when DNA fragmentation is high. Emerging therapies on the horizon include stem cell therapy for regenerating sperm-producing cells, advanced sperm selection techniques, and epigenetic interventions. Practical steps and hope. Secondary male infertility can feel confusing and isolating, but it's treatable. Schedule a detailed fertility evaluation for both partners. Document lifestyle changes since your previous conception. Go beyond standard semen analysis to assess sperm quality thoroughly. Correct treatable issues. Adopt healthy habits, and consider assisted reproductive techniques if necessary. Remember, open communication between partners and seeking emotional support makes a tremendous difference. Fertility may change over time, but with proper evaluation and treatment, many couples facing secondary infertility can still achieve their dream of expanding their family. Please like the video, share the video, and subscribe to our YouTube channel. Thanks for watching.